My name is Jody Stafford. I'm a registered occupational therapist in the state of Florida. So I'm an OTRL. I'm primarily in the rehab settings. I focus my treatment area in home health, and I specialize in geriatric orthopedics and neurological disorders.
So tell me how you've used this for your patients.
The first person that I used it with was a neurological patient. He was a cerebrovascular accident. He had a blood clot in his brain, and it caused him to have fine motor coordination and dexterity problems and paralysis on the left side of his body. And he and I first started using it for problem solving, following directions, and fine motor coordination. And then once he got stronger, I was able to put weights on his arm and have him use the puzzle for dynamic strengthening in his biceps.
You solve the wooden Mentagy puzzle by placing the letter pegs in the grid, starting with A, going in alphabetical order from A to Z.
Very interesting.
He didn't have a lot of motor control. He was very ataxic, which means when he went to move his arm, it started shaking. So he wasn't able to have a lot of fine motor coordination to pick up like each individual letter. So what we started with was no weights at all. So he was able to, immediately control the puzzle. And then when he was going to go move a weight, I would strap a weight to his arm, and it actually slowed down his shakiness, his trembling. So it was about a total of 8 to 12 weeks.
Okay.
To work on every problem that he had. Cerebrovascular accident patients usually have a problem with both neurological and cognition. But if it were just a patient that was an orthopedic patient that needed strengthening, the puzzle could help a patient within 4 to 6 weeks. But if it was all a neurological patient, like multiple sclerosis or cerebral palsy or any other problem that affects the brain only, it would take about 6 to 8 weeks. This puzzle works on both afferent and efferent pathways, in that you actually first have to decide what you're going to do. The brain has to decide what it's going to do, and then it has to problem solve, even through the damage. If you had a neurological impairment, whether it be a block or oxygen deprivation to the brain, it has to communicate something to the brain through an afferent pathway. And then the brain has to actually problem solve and then communicate through an efferent pathway its intention on what it has to do. So the reason that I liked the puzzle with my patient is it worked on both pathways, and I could use my NDT treatments and the physical strengthening with my neurological patient, and it worked great. And he was my first test study with Mentagy on the puzzle that you gave me, and I had a lot of success with it. I discharged him, I think, within 12 weeks with all my goals met.
You mentioned there was some other patient you used. Could you just give an example of just one other patient that you used the Mentagy puzzle with, and explain how that worked out?
Okay, she was a patient that had fractured her humerus, her distal humerus, which is down here, and she was not able to use her arm or lift her arm at all, and it was immobilized for approximately 2 months. And during that time, she had a lot of muscle atrophy, and I used the Mentagy puzzle with her to promote her dynamic standing balance and use of her arm. With her as well, I started without weights, and eventually I was able to put up to a 5-pound weight at the end of treatment on her arm, and she was able to do the Mentagy puzzle the entire time in standing. And it helped build up the deltoid muscles in her arms and her biceps and triceps. By the end of it, she was able to do. Well, she was standing, and I had the puzzle probably at a higher level. Initially, I had started her off a little bit lower, and then as she was able to get a lot stronger and improved range of motion and less edema in her arm, I raised the puzzle up, and she was slowly able to bring her arm up with a 5-pound weight on it, and it was able to help her deltoid muscle, biceps, and triceps get stronger. And I had her do it repetitively every day, and I left her the puzzle as well. And her home, I only saw her, a couple times a week, and she was able to use it for about a month until she reached her goals, and I discharged her as well.
Now, so would you say that this puzzle is more effective than, say, other more standard or usual means that have been used?
It's more effective because it treats not only psychosocial disabilities, cognitive limitations, but physical disabilities as well. So it's more, I would say it would be more of a holistic treatment and with multiple disorders and limitations than other strengthening things that we would use, such as like a TheraBand or a dumbbell weight, or a therapist could specialize it to work in all applications. You could use it in inpatient hospitals, rehab facilities, home health, psych hospitals. It's portable. It could go anywhere. It's easily adaptable to low-level patients and high-challenge patients that they have. So we try to retrain the brain through neurodevelopmental treatment techniques to reroute nerves through alternate pathways.
So your actual physical training has an effect on the architecture of the brain or structure of the brain, in a sense?
Yeah, it's almost like when you are a baby and you're developing neurons. A baby first has to learn to hold its head up, and then it has to sit up and right itself, and then it has to learn good trunk stability, and then it can stand, and then the baby can walk, and then it can run, and then it can skip. So there's a process, there's the developmental process that you have to go through. And when you have nerve damage through a CVA or for a traumatic brain injury or any other kind of neurological impairment in the brain, you have to go through those same baby steps. So training it to do things and practicing through puzzles and constant problem solving will reroute nerve pathways in the brain. It takes a very long time. It's not a dramatic overnight process, and it takes a very long time. And the sooner that you begin therapy after the damage, the better. Probably in relating it to the patients that I've experienced with Mentagy, it probably has more to do with the constant attempt and trying will stimulate the nerve pathways quicker than just time and performing like ADLs or activities of daily living. Mm-hmm. The more you attempt to reroute the pathways, the more you attempt at neurological stimulation soon after a damage, the quicker the return would be. When I discharged him, he loved it so much, I was asked to leave it with him, and since I only had one copy of it, I told him where he could buy it, and I told him unfortunately I had to use the puzzle with my other patients. However, I was very glad that he enjoyed it so much and that it helped us in achieving our goals, and I got him in touch with you, and he was able to purchase one of them, which was very nice. He still works on it today.
Good.